All right, good morning everyone. Good morning Queensland. Good morning to all of our Facebook Live followers as well. So today we have some good news in that we only have 3 new cases. One is in hotel quarantine. Now the 2 other cases, one is linked to the aviation cluster, so it's linked, which is very important. Dr. Young will give some details of that case. But to say, I have to let everyone know that that person was down at the southern end of the Gold Coast for 4 days, so it's going to be very important for people in that southern end of the Gold Coast if you have any symptoms to go and get tested. So he was with his family, I understand, at Kirra, but Dr. Young will go through that. And then we have one other case acquired from interstate and in the Queensland community for only 1 day. So that's very good news. So on top of that, Queensland, the other good news is we have had 19,764 tests. So that gives us an added layer of confidence at this stage, but we do want to see continual high rates of testing to make sure we do not have any community transmission. So what's really important at the moment, and the fundamental reason we are not in lockdown, is because we do not have any seeding or unlinked community transmission. If we do see any unlinked community transmission, I'm quite sure Dr. Young will not hesitate to recommend a lockdown. So that's good news for the moment, Queensland, so keep up that great work. The other good news is our vaccination rates are continuing to go well. Another 21,712 vaccines were administered by Queensland Health yesterday, and that takes us up to 2 million so far. That 65.72% have had at least 1 dose and 46.74% are fully vaccinated. Now don't forget, all of our hubs accept walk-ins. So if you have not had your vaccine, today is the day to go and get your vaccine. There's the weekend coming up, go and get your vaccine. It is very, very easy. And also, if you don't go to the vaccination hubs, go and see one of your local GPs, or of course the pharmacies are administering that as well. So that is fantastic news at the moment, but we do need to make sure that people in Brisbane, Logan, Gold Coast, Moreton Bay, Townsville and Palm Island continue to adhere to those stage 2 restrictions. We need people to keep getting tested. We need people to keep wearing this mask. And we need people to use that check-in app. Our contact tracers are doing an incredible job at the moment. What is making their job easier is the fact that people are continuing to use that check-in app. So that's great news. I'm going to hand over to Dr. Young.
Thank you, Premier. So yes, 3 new cases in Queensland today, one of them in hotel quarantine, acquired overseas in Egypt, so not a risk to the community. Then the other 2, one is a new cluster. So this is a gentleman who travels up and down from New South Wales, picking up animals and relocating them. So he was infectious in the community for a short time in the Gold Coast when he was picking up an animal there. He was contacted by New South Wales Health that he was a positive case, and New South Wales Health then has let us know. So he was in the Gold Coast on the 29th for a short period. So I don't think he's a risk. He's unrelated to any of other cases. Then the 3rd case is another person who is closely linked to the heavy lift outbreak, the aviation cluster that we have. So he was at the offices from the 20th to the 24th when we know transmission was occurring in that office environment. So he is clearly linked. Then he went with his family down to the Gold Coast and stayed in Kirra at the iconic Kirra Beach Resort for 4 days, and he was infectious during those 4 days. So it's important that anyone who's been in Kirra over that period, so those 4 days of concern are the 25th onwards, anyone who's been to the North Kirra Surf Life Saving Club, to Kirra Surf Club, to Time Zone, to some local cafes, to Woolworths at the Strand. We'll put out the specific times, but please, anyone who's been to any of those venues or anywhere in that part of the Gold Coast over the last week. If you've got any symptoms at all, now is the time that you really please come forward and get tested. So we'll just be working through all of that today with that gentleman. So thank you to those 19,497 people who got tested. We did 19,764 tests yesterday. That's critical. Please, any signs at all of any symptoms, come forward no matter where you are in Queensland and get tested, because then we can get on top of an outbreak as quickly as possible to stop it spreading. That's really important. We now in Queensland, reassuringly, 65.72% of eligible Queenslanders 16 years and older have had at least their first dose, and 46.74% their second dose. So please, we have plenty of vaccine. There is walk-in capacity available. Our GPs, our pharmacists are doing a fantastic job. Everyone. There is absolutely no excuse. It's easy to get vaccinated now. There aren't long queues, so please come forward. You don't need an appointment. If you do have an appointment in the future, don't worry. Turn up now. Let them know you've got an appointment so they can cancel that in the system. But just come up today. We've got a long weekend, which is a perfect time to come and get vaccinated. And it's really important, because the sooner we get all of us vaccinated, anyone 12 years of age or older, the sooner we can relax a little bit. And we know that people who are vaccinated are very, very unlikely to get severely ill and they won't die. So that is what you need from a vaccine. We know though, and we've seen it with this most recent outbreak, we know that being vaccinated is not enough to stop you passing it on. So that's why each of us needs to be vaccinated so we don't acquire it and get a severe illness. Thank you.
So thank you to the 19,000 people who came forward and got tested yesterday. Please keep coming out and getting tested. This is absolutely critical. It's been about 3 days since these new clusters started to appear, and the good news is we haven't seen any of these actually lead to community transmission. All the positive cases have been direct close contacts from the actual workplace and the training facility and direct household contacts. So we want to keep it that way, make sure that people are coming out and getting tested. We also want people to be checking the website regularly. There was a lot of new exposure sites that went up yesterday. There'll be new ones on the Gold Coast. There were a lot that went up around the North Lakes area and North Brisbane yesterday. So please keep checking that website and making sure you're aware of those sites and whether you have been to any of those areas, and follow the health advice. Now, vaccinations. I know there's lots and lots of families who are travelling around Queensland right now on school holidays. Don't wait till you come back home. Get vaccinated on holiday. If you're passing a vaccination site or you know there's one nearby, pop down and get a vaccination while you're on holidays, because the quicker you get vaccinated, the quicker we can protect our community. Unlike the last time we had to lock down in the Indooroopilly cluster, this time we know exactly where all these cases have acquired the virus from. And importantly, we've had a 20% increase in our fully vaccinated population since then. We have now hit over 4.8 million doses had been administered in Queensland, but we want more. So please don't wait. We want people to come out and get vaccinated as quickly as possible, because it will be at least 5 weeks until you are fully covered. So if you want protection as quickly as possible, you need to be coming out today and getting vaccinated, and all of our centres are open to walk-ins. As Dr. Young said, even if you have a booking for your first or your second dose, if you have a booking in the following days or weeks, you can still walk into one of our vaccination hubs today if you are due for your second dose. If you're getting your first dose, you can walk into any one of those clinics and get a vaccination today. Also, a big shout out to our GPs and community pharmacies. We are seeing an increase in people going to our GPs and pharmacies and getting vaccinated. You have so many options. You have so many different vaccines available. Don't wait. Come out and get vaccinated today.
Thank you, Premier. If I could just focus on compliance for a start. We are seeing large flows of people, so 14,606 vehicles intercepted at our road borders yesterday, and 169 were refused entry. So the message is out there. We are in level 2 restrictions. If you're coming into Queensland, if you're coming into those areas and those restrictions, make sure that you comply with the requirements. One person was issued with an on-the-spot fine for attempting to unlawfully enter into Queensland. We did see an increase in masks being handed out, so 67 yesterday compared to 6 the day before. That's probably not surprising given the current restrictions, but the reminder is there for everyone. You are required to carry the mask and wear them when you should. Whilst we saw no fines yesterday, if people are not compliant, they can expect us to take action when necessary, so please carry your mask and wear it. There were 2 arrests, one at Gold Coast Airport yesterday for a person failing to follow the directions of emergency officers and the Chief Health Officer, and also charged for possession of drugs, so probably not a good idea. Also another person at Logan who failed to follow the directions and also was arrested for carrying weapons and obstructing police. So our police will take action out there if people do the wrong thing, and please comply with those directions. Could I mention our investigations into the woman who crossed into Queensland, became positive from Kyogle, has now been concluded. I'm able to say that that person did not attend any party. There was an attendance at a pub in that area down there, a small gathering. We have dealt with that matter through an adult caution. It is the appropriate response to that, and we thank that person for the cooperation that they did give us in able to investigate that. The investigation into the truck driver from Punchbowl continues. He will be further interviewed today, and once that investigation is concluded, we'll advise what's happened with that. Thank you.
The guy from New South Wales picking up animals, what was he doing? Is he in adjustment, or is he working the lane?
He's covered by the freight protocol, so he's moving freight, he's moving animals. That's quite a legitimate reason.
He was infected in New South Wales?
Yes.
So
yes.
That's why there's no concern about him?
Well, no, it's because he was here for a very short period while he was infectious.
But he's since gone back to New South Wales?
No, he's still here.
Right.
But as soon as he was rung by New South Wales, he then isolated. So we're just working all that through now. So I'm not concerned about him.
How concerned are you about the man who's in Kira though? It's family, school holidays, lots of families are mingling around.
Yes, but hopefully people down there are wearing masks. They'll come forward if they have any symptoms and get tested. So we're working all through that. But it's really, really important. So we did put those restrictions on the Gold Coast. So it's important that people abide by them.
You said he was a family, with his family. Do we know how many family members?
Yes, so he has a wife and 2 children.
And they're all in quarantine?
Yes.
And is
Yes.
it good news that there's been no cases up in North Queensland, in Townsville?
Yes, it is. Yes.
Are you feeling any better about it today?
I'm still concerned. It's really important that people comply with the restrictions that are in place for those 6 local government areas. One other thing I forgot to mention in my earlier update is you would have seen that New South Wales has removed the restrictions on Walgett. So we will similarly put them back into the border zone, allowing that small amount of movement. So that will happen from 1 a.m. tomorrow. And New South Wales has put stay-at-home restrictions in place for Kyogle, so we will also put those higher level of restrictions in place for Kyogle from 1 a.m. tomorrow.
Sorry, one more for Dr. Young. Do you think the NRL grand final will go ahead?
We just need to see what happens over the next few days. So we've put in place those restrictions, the 75% capacity limit, and that people must wear masks at all times, except when they're in their allocated, seated, ticketed seat, when they can take them off if they're having something to eat or drink.
Sorry, Dr. Young, just quickly. We're on school holidays, but do you have any concern about movement this long weekend? People may be taking the virus from Brisbane or Townsville into other regions?
That's a very good point. So people, when you move out of one of those 6 LGAs, you take those restrictions with you wherever you move. So you need to wear a mask at all times. You need to be seated when you're eating and drinking. So you've got to follow exactly the same restrictions as if you're at home. And those people who are coming from areas that don't have those restrictions, when they come into an area that does have the restrictions, so say someone's been up at Cairns and they're coming back to Brisbane, then when they come into Brisbane, they're bound by the restrictions when they enter Brisbane. Thank you for that.
The NRL needs 36 hours notice to move the game north to Townsville. Would you make a decision as late as 36 hours out from the game?
No, we'll see what's happening on Sunday morning.
Premier, have you spoken to the NRL to physical aid? Where are those discussions? What's he needing for?
The head of tourism has been and sport has been speaking with the NRL. But can I just make it very clear? If the advice is to go into lockdown, we will go into lockdown. Okay, so there's no ifs and buts here, people. This is serious. So it's going to depend whether we see any unlinked community transmission over the next 24, 48 hours.
Are you
Would it
hopeful
take
to go
just
ahead
like
though? Based on what the current outbreak, given there's no unlinked cases.
Sorry, Lydia, I can't hear you.
Sorry, given there's no unlinked cases, are you hopeful that the game's going to be able to
Well,
go
it's
ahead?
going to depend what happens tomorrow. It's going to depend what's happening the next day.
But
But it's encouraging news today. It's encouraging news today that we do not have any unlinked community transmission when we've had a high level of testing.
And the
But
Prime
what you've
Minister,
said, you'd have no qualms in saying, sorry, can't go ahead.
I will have no qualms. Okay, people know me. They know Dr. Young. Dr. Young gives us the advice. We will act immediately and we will act swiftly and we will go hard and we will go fast. No ifs and no buts. Sorry?
Just one unlinked case.
It will depend on the situation. We will get that advice. Okay, but at the moment we've got great contact tracers. They're doing their job and they're not unlinked.
the Prime Minister's
This plan for international travel to resume.
Well, I look forward to hearing about the plan. I understand that the Prime Minister will be doing a press conference at 10:30. I look forward to hearing about that plan. It has not been distributed in any papers to National Cabinet prior to National Cabinet's meeting.
the Prime Minister's expected to announce that it'll reopen in November. Will Queensland have reached 80% vaccination by then?
I'm not going to agree to anything when I haven't seen any formal paperwork, Lydia. It would be irresponsible, and I think Queenslanders would expect me to see some paperwork to understand the issues before an announcement is made.
Would you be
So
against-
it's a bit disappointing that we haven't been given that due courtesy before National Cabinet.
Would you be against the border reopening before Queensland reaches 80% vaccination?
What I've said very clearly, and Dr. Young has said this, the Health Minister has said this, we need to be in a situation where every eligible person in that cohort is offered a vaccine. Now, what I'd like to see from the federal government, we're running campaigns at the moment to get people vaccinated. It'd be great to see the federal government focusing on a national campaign to really drive those vaccination rates up. We've got to make sure we're getting out to our Indigenous communities, that people with a disability are getting vaccinated. And of course, I've said previously, we need to have a plan for those children who will be unvaccinated.
Premier, New South Wales will allow people who are double vaxxed to come back to Australia and quarantine at home for 7 days. Will Queensland follow?
My understanding is they're doing a trial and South Australia is doing a trial. I think we would need to see the results of that trial.
Now, let's get quick one from the Minister, if I could.
Sorry, any more for me?
Oh, yeah, with the Doherty modelling of National Cabinet, when will Queensland...
Well, we haven't got the updated modelling, so I'd love to see the updated modelling.
Once you do receive it, when will Queenslanders know your kind of plans?
When I see the updated modelling,
What specific details are you looking for in the modelling to make those decisions?
well, the Doherty people have gone off to do some further work and that has not come back into National Cabinet yet. If it doesn't come in today, I understand it's coming in at the end of the month.
Do you expect ICU...
Oh, sorry, middle of the month, sorry.
Do you expect...
We're in October now, so it goes very quickly.
Do you expect hospital ICU surges to be discussed in National Cabinet, and what will you be pushing for?
I might get the Health Minister to discuss that because she's been speaking with the other health ministers. But let me say this is another crucial factor. Not only do we need to make sure that we get as many people vaccinated as possible, there's another big part to this story. And that is to make sure that the hospitals can deal with the capacity, because when Delta comes in, it will spread like wildfire. Okay, we're already seeing increased surges in New South Wales hospitals and increased surges in Victorian hospitals. So the hospitals need to have the capacity, and that requires on additional funding coming from the federal government to support the growth in the numbers that we will see. This will be unprecedented. So this is dealing with the global pandemic. Everyone has seen what's been happening in other parts of the world. It is going to happen right throughout Australia when this Delta virus spreads. So we need to be prepared. There needs to be a lot of work that needs to happen, and we've got to get this right. There is no use rushing. We need to make sure we get the people vaccinated and the hospitals prepared. And until you do both of those, it would be irresponsible to put the whole country at risk. And I'm not going to put Queenslanders at risk until both of those issues are sorted out.
Sorry, regarding your exemption unit, there was criticism of it kind of in the last fortnight. I've been in contact with someone who was informed by a member of the exemption unit that cases are being backlogged back to September 6th in terms of their applications. Are you satisfied that there's been an adequate...
We have increased the exemption unit. This is a difficult time for everyone. There are thousands of people applying for exemptions. Why are they applying for exemptions? Because the Delta virus is running rampant in New South Wales and we're seeing an explosion of cases in Victoria. That is why we have an exemptions unit. We wouldn't have an exemptions unit if that wasn't happening in the southern states, and we wish for everyone to get these issues under control. It is a very, very difficult time for families, not just here, but families right across the country.
How many people now are in that exemption?
Do you know when we might be back on?
Oh, I might get about to it, but the exemption unit has been increased. We've got the Deputy Chief Health Officer now running that exemptions unit. But, you know, there are a lot of cases there, a lot of issues there, and people are working through it as methodically and as compassionately as possible.
How many staff members are now in that exemption unit? How many staff members are now in the exemption unit?
I don't have that. I think was it up to 90 or something? They were increasing it.
On the hospital
Yes.
capacity, so the extra funding you're talking about to boost hospital capacity.
Well, at the moment, we have a large proportion of people who are basically should be in aged care. There's about 600 from memory that need to be adequately looked after by the federal government, which is their responsibility to open up that capacity for people who will end up with COVID.
So you're saying you want that sorted out before the borders?
I think all the health ministers want that sorted out. So I'll let the health minister talk about that. My understanding is they wrote to the federal health minister raising serious issues about the capacity of the hospital system to deal with. You only have to look what's happening around the world to see the surge on hospitals. That is why you've got to get your vaccination rates up as high as you possibly can.
Tanya, what's your message to the tourism businesses up around Cairns who've woken up this morning, read the news that people in Sydney might be able to travel over to Europe and vice versa?
People in Sydney are in lockdown. People in Sydney are in lockdown. And I think the last thing that they would want is a massive outbreak of Delta in Cairns. Then they would be in lockdown.
But what's the sort of projection once we reach a certain threshold of
As I said,
vaccination?
there are two key thresholds here. High rates of vaccination, plans for our children who are unvaccinated, get the plans there sorted out. And then secondly, the hospital capacity. And that means a big injection of funds from the federal government into the states to make sure that the hospitals will be able to cope with the growth that will happen.
Do you think that people will be able to travel to Queensland by Christmas?
I don't have a crystal ball. I would love people to be able to travel, but we will do so when it's safe. If it is unsafe, it will not happen. So we'll do it when it's safe. The high vaccination rates.
What level of vaccination rate?
Sorry?
What level is a high
That's all being worked
vaccination
through. That's all being worked through. Everyone needs to be, every eligible person needs to be offered the vaccine.
You say that the vax stats accounted from eligible people 16 years and older. Now that only like 12-year-olds and older can get vaccinated, why aren't they included in the stats? Does that mean that they could be...
We'll be keeping data on that, and I want to see as many 12 to 15-year-olds vaccinated as well. That's why it is critical, everyone in Queensland, to come out and get vaccinated. Okay?
Do you have the data on the 12 to 16-year-olds that have...
We're keeping that. We're keeping that.
Where can I find that?
We'll get it to you.
There's reports coming out this morning that Flight Centre CEO signalled that they might launch some kind of court action if there's no clear plan in WA and Queensland to reopen.
Well, good luck to them.
Dr. Young, was there going to a vaccination?
The most recent.
The family who went to...
I don't have that yet. No, I only found out about that case quite
Dr. Young, are you able to provide any detail about the 8th case from the aviation cluster yesterday that has gone to New South Wales since? Yesterday you said there was 7 in Queensland and 1 in New South Wales. Do we have any more detail?
Yes, we know about that one. So that person was infectious here. Oh, sorry. I keep on forgetting about them. Sorry about that. Yes, so that was one of the earlier ones. They just happened to be in New South Wales.
So they attended that meeting at the aviation
Yes,
centre on the 20th?
yes,
Okay.
yes.
And they've been allowed to go to New South Wales since?
Well, no, they went. Yeah. No, they went to New South Wales. Yeah, they weren't allowed, they just weren't.
So very quickly on the issue of ICUs, and can I be clear, when we talk about the new norm on our health system under COVID, it is not simply about how many ICU beds and ventilators there are. It's about the effect it's going to have on our entire health system. How many people are going to be off work and needing to see a GP because they've got COVID? How many people are going to be turning up in our emergency departments? How many people will be calling on our ambulances to transfer them to hospital because they are unwell from COVID? This is on top of our extreme demand we already have across every single health system in Australia. Our demand levels were at peak already because of growth, people dropping out of private health, ageing population, increased acuity and complexity about health conditions. So we were already feeling the pressure of demand, and COVID has come over the top. So what every single health minister in Australia, every single health minister from every state and territory has signed a letter to the Commonwealth Health Minister, Greg Hunt, and said, we need extra funding, we need 50-50 shared funding, we need uncapped funding and a funding guarantee. We've had a funding guarantee under COVID until the 30th of June. That has now stopped. That needs to be reinstated. We need help with NDIS. We've got too many people who shouldn't be in hospitals with disabilities, who should be in care under an NDIS package, who are taking up beds. We need that rectified, or the Commonwealth needs to fund us for those beds. And we need further funding and support in mental health, because the numbers we are seeing of our ambulance call-outs and our ED presentations and our beds on mental health is going up. All of these are because of COVID. So when we open up and people are vaccinated, there will be more COVID in our community, and there'll be more pressure on top of flu season and everything else. This is why every health minister of all political persuasions said enough is enough. We need action. We need commitments right now, because we are all trying to plan for the future beyond lockdowns and restrictions and how we live with COVID, and we can't do it on our own. The Commonwealth needs to support us in this.
Minister, what's the state done over the last 18 months precisely to address that issue on its own?
We have expanded our capacity. We've built individual rooms, negative pressure rooms. We have made sure our staff are trained and prepared to deal with infectious diseases. But that doesn't change the fact that we rely heavily on Commonwealth funds for our public health system. That every time the private sector, primary and allied healthcare fails, someone can't see a GP for 2 weeks or 4 weeks. They can't get bulk billing. There is no GPs in their community. There's no allied health. They come to our hospital system. So there's so many things that the Commonwealth are directly responsible for, including aged care and disability, that impact on the public health system. We have regions where there's complete market failure, there are no providers, and everyone's walking into our public hospitals. Even if they have private health, there's no private health beds for them to take up. So this must be done in cooperation. That's why we ask a 50-50 funding split. It was agreed back in 2012. It's never, ever got to where it's supposed to, and it's been capped by the Commonwealth. We need a serious conversation in this country about the funding commitments from the Commonwealth on our entire health system, not just public, but our entire health system. But we need some urgent, immediate help, and every state and territory health minister is calling on that. And we hope that we will be listened to.
If that's not addressed, will that impact us opening up?
It will impact our entire economy if our health systems cannot manage COVID. Every single state. We know that there's politics being played with health demands and ambulance ramping and everything else. But every single health minister knows, every premier knows, of all political persuasions, that our health system must be able to manage COVID, or our economies cannot manage COVID. So that's been clear from day one. We've been doing our absolute best, but we need commitments from the Commonwealth, and we need it now.
Thanks, everyone.